Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy podcast studio, and we are super excited to have David Foucachon discussing Veritas Surgery on our podcast today. We have a lot to go over, so we better get started. David, welcome to our show.
Thank you, Shawn. Hey, Janet. Good to see you.
Hi.
Hello. Okay, so first of all, I want to say that David is going to be speaking at our Medical Freedom Northwest conference. Go ahead and stream that, Julie. April 20th in Spokane. David's going to be speaking about his surgery center and free markets in healthcare. And what this conference is about, it's about starting or finding a successful cash healthcare business to either create yourself or work at, because there's a lot of people in healthcare that are disenfranchised with the insurance-based model. And David's going to be talking about that too, and why he went into that and why one of the doctors he partnered with wanted to get out of that. So today is the last day to sign up and save $50. It's $199. You get 7 hours of CME. You do not want to miss out. It's going to give you a great opportunity to learn about a parallel system outside of the traditional insurance-based healthcare system. So go to MLRX.com, stream down to the very bottom, and it'll say April Weekend Retreat, and you can sign up there. So you don't want to miss out on David speaking. And speaking of David speaking, let's get started with David. So David, go ahead and stream the Veritas website. And as we do that, David, tell us a little bit about why you started Veritas Surgery.
I'll start with the name. Veritas means truth in Latin. The medical industry is defined by intentional obfuscation. There is very little truth in pricing, very little transparency on the economic side. I'm predominantly addressing the economics here because we have one of the best medical systems in the world in terms of the care. We have incredible medical care in the US. It's financially broken. And that's the part that we are tackling is just the misalignment of incentives and the unintended consequences that result from that originally I would argue started with government intervention. And so the finances of the economics of healthcare, that is the part that we are tackling. And so Veritas Surgery, we are a direct care, multi-specialty direct care surgery group. So we work with some of our surgeons are in-house, employed. Others are hybrid. They have one foot in the traditional insurance world with a private practice there, and then one foot in the direct care economy through Veritas. But we represent orthopedics, general surgery, podiatry. We're looking to add gynecology soon. So surgeons who are fed up with the status quo, fed up with the financially broken aspects of our system, and who are just wanting to bypass the illegitimate gatekeepers.
Awesome. That's a good introduction. Go ahead and stop streaming that now, Julie. So wait a minute. Transparent pricing. I just don't get it, David. Healthcare is complicated. Surgeries are complicated. How can you really decide what a price is before the surgery?
Well, ultimately, we don't decide. The market decides. So a willing buyer and a willing seller, that determines a fair price. And right now, most medical care is not paid for that way. Most medical care is paid for by a third party. It's paid for by an insurance company. And kind of getting ahead of myself here because kind of like the why of Veritas, why is healthcare so expensive? Predominantly, it's expensive. There's so many reasons, but the biggest reason is because the gatekeepers, the people who are making the decisions of who's in network, who's not, who are patrolling this economy as it largely exists, all of those by and large, most of those gatekeepers want high prices, and that comes as a hard pill to swallow for some people. You're right. Like, oh no, my insurance negotiates on my behalf. They saved me so much money. It's like, that's actually a lot of smoke and mirrors. They do not. The insurance company wants high prices. I'm sure we'll get into that in a bit. But what we're doing, so what's happening in the world of free market surgery, and I should say what we're doing, we're not the pioneers in this movement. Men like Dr. Keith Smith from Surgery Center of Oklahoma. They were the first to do this. They were doing this back when it was weird, back when the thought of posting prices online was unheard of. It's gaining steam now. We're riding on that wake, but that's what we're doing essentially. We are between our own surgeons and then the facilities that they operate at, and every other provider along the way, every other provider of medical services, the anesthesia group, the suppliers of durable medical equipment, the pathology labs, every piece of that, every player in an episode of care, we are contracting mutually agreeable pricing with them and saying, it's like when we went to the DME provider, we were like, hey, so we'd love to work with you because you already work with some of our providers. Can we get a cost list? And just so you know, we're comparing to Amazon.com. So it's like, okay, we can work with that. So, it's like right off the bat, you start that conversation and all the normal paperwork and the normal price, they just put that aside because we're talking real prices now. We're talking buyers willing to pay what the market will bear and what would be a genuinely mutually beneficial exchange. And so we do that with everyone. You do that with the facility. We do that with the suppliers, and we put that bundle together, and then we become the seller of that bundle. We own it. We take responsibility for it. So when we quote a price to a customer, we actually have the patient approve the quote. So, and this gets to your question about complexity. A lot of people go, "Oh, there's too much variability in medicine. There's no way you could know ahead of time." And I actually,
as you could probably tell, I was being cynical.
Oh yeah,
because I know your answer. It's not complex. I mean, my comeback when hospitals will say, "Well, we can't post prices because it's too complex." I say, well, a new car is a pretty complex piece of machinery, but they know exactly what the price is. You go.
Or even like, how about when you go to the mechanic, a good mechanic. It's like, I love I use Urberato here in town. Every time I go in, sometimes I go in, they don't know what the problem is when I come in. I'm not going to demand they tell me right at the counter. I want to know exactly what my bill is going to be at the end of the day. But I do know what it will, like before you perform the service, or even if you're going to say it's variable, I'm going to get a breakdown of what my options are. I'm going to see the menu. And so that's kind of what we do with our patients. They come in, we have all our prices listed on our website. So they know that if there might be secondary procedures that we don't know until we get in there, but ahead of time what it's going to cost. If you're going in for the ACL, this is the price. If there's a torn meniscus, it's going to be this much more. And so what we actually have the patient do is pre-authorize. We don't have the insurance company pre-authorizing. We have the patient saying, I approve this quote. I know that it's going to cost this. It might cost this much more, but it will not cost more than this. And that's the guarantee we're making when they say, I approve this quote.
And that's no different than, like you say, you go to your mechanic and they say, well, you know what? It's going to be $1,000, but it could be $1,500 if this is what's wrong. Do you want me to go ahead with it? Of course.
Exactly.
Healthcare is like no other industry. Where there's no transparency. It's like, you can't compare it to a hotel. You can't compare it to auto repair. And it really should be the same. I got to ask you a quick question. I'm going to let Janet ask you a question. So I didn't know that you contracted with durable medical equipment providers, which, Janet and I used to own durable medical equipment.
Oh, I didn't know that. Okay.
Yeah. It's been quite a few years. So when somebody does an ACL surgery, I'm assuming they need some kind of knee brace.
Yes.
Right. So that knee brace is covered in your transparent price.
It is. Yeah.
That is the coolest thing. I'm sorry, but that is the coolest thing.
Here's what's covered. When you see a price, any CPT code and with a layman's description on our website, that includes the surgeon's professional fee. That includes the anesthesia. That includes the facility fee. That includes any standard durable medical equipment that'll be needed with that. That includes implants, and that includes any pathology that's needed. That is the complete episode of care.
And what about, I'm putting you on the spot here. I said I wouldn't, but I'm putting you on the spot here. I know with with total knee surgeries at Surgery Center of Oklahoma, they include some PT visits. Do you include PT in any of your stuff?
Not yet.
Okay.
I'm actually in conversation with a direct care physical therapist. And I actually called him
love
up. It was after that your brother's case there, where we were looking at the whole package. I called him up. It's like, hey, do you know ahead of time? It was Tom Miller, who has a cash pay direct care physical therapy. And I called him. I was like, do you know for an ACL repair, can you say with reasonable degree of certainty how many visits that's going to be. And he's like, yeah, absolutely. So that would be
cool.
probably an add-on, because some of our patients travel. And so in that case, we would be wanting to connect them for something like physical therapy, connect them to a local cash provider. If they're local, it's like, yeah, here's the price for your surgery. Click the add-on, bundle physical therapy. And that's great for the physical therapist, because that means they get cash up front. They get predictability. They're getting paid for 20 visits. And then it's a single bill for the patient, which a lot of our patients are members of Healthcare Cost Share Ministries. And so that makes their life so much easier when they get one bill. They don't have to keep track of 12 bills, and you never know if there's more coming.
Yeah. So we call them surprise bills.
Yep.
Janet, go ahead and ask David a question.
So David, I'm being cynical too. You mean to tell me you know how much something costs when you are going to give a surgery or a procedure? And how do you know that? Because, isn't it, like Shawn said, so complicated? I mean, how does the doctor know ahead of time, or the surgeon knows ahead of time how much time it's going to take him to do this procedure, or how much, what kind of equipment or braces? I mean, isn't that complicated?
We take some tea leaves and we mix them up, and we
Yeah.
No, we know because it is, we're not dictating, we're not deciding what the market will bear. We know what the market will bear. And so then we approach each party who participates in that episode in care and says, hey, here's what we see in the market. Here's what this will bear. Is this an agreeable price point to you? And if they say, yep, this whole price list is agreeable, we're going to the providers themselves. We're going to the people providing the services, the people who are paying the implant bills, the people who are paying every piece of that equation, and committing ahead of time to what a mutually beneficial price would be, which is the mirror opposite of how cost containment typically works in the medical industry, where you first get the services, get an outrageous bill, and then play this elaborate game of chicken about, well, I'm not going to pay that. That's too expensive. Okay, will you settle for this? And you end up with so much wasted time and resources of arguing back and forth with the provider about what a fair price is. But it's like, you've already had the service. It's like arguing with the waiter after the check comes.
Right. That's
You
great analogy.
you can say the house red, you didn't mention the house red was 200, or that's an unreasonable price for the market fish, but you might get some concessions, but you're never going to make up for the fact that you ate at the wrong place.
Right.
You should have been at that place across the street that posted their prices. And so that's where we are. The current state of cost containment in healthcare is largely that ridiculous conversation with the waiter that gets increasingly belligerent, where it's like, okay, then sue me. Okay, I'll sue you back. Or you just accept. Yeah.
I mean, I can hear you going on. And one of the reasons it comes out so easy is because this is true. You've heard this over and over again with consumers fighting for prices for healthcare that are ridiculous prices, and you have to try to negotiate to get them to come down. And it's just, and like you say, they should have stayed away in the first place, but we'll get into later. But because of our traditional healthcare model, our health insurance model, they're told where to go in the first place. And it has nothing to do with the quality. And I want you to speak on this. In-network insurances have nothing to do with the quality of the surgery they're going to get. Some people would argue, well, if your surgery is cheaper, it must be less quality. You go.
Yeah, that would, in most industries, that's a reasonable assumption to make, right? The $1 million house is probably going to be nicer than the $500,000 house. Just about anything and the reason that we have that assumption is because that's market forces being reflected. It's consumers, it's buyers voting with their dollars. And so you get supply and demand forces. And that's why we have price signals. So it's a reasonable assumption to assume normally a higher price is higher quality. All of that breaks when you don't have consumerism. And in healthcare, by and large, we don't have consumerism. So we have this paradoxical situation in healthcare where there is, painting with a very broad brush, by and large, an inverse correlation with price and quality. And one of the reasons for that is, there's multiple reasons, but one of those is the person, if you're going to serve the buyer, if you're going to serve your customer directly, you're going to have to be good at what you do. because you're
Very good
competing on
point.
value and quality.
Yeah.
If you're getting paid by an insurance carrier, they're the customer. The patient's a beneficiary. The patient is a vehicle to get to their insurance card, but the person who's paying you is at the end of the day who you're serving. And so yeah, you don't have those price signals coming from the normal consumerism that we see in every other industry. You are catering to what's going to make the insurance company happy, which, back to that original hard pill to swallow, the insurance companies, and I'm referring to, what we call the BUCA carriers, Blue Cross, United, Cigna, Aetna, the big players who spend enormous, unthinkable amounts of money on lobbying. They want high prices. You want to get into that now?
I have a point about what we're talking about, and slightly different, but I remember when we started to have corrective eye surgery and how expensive that was, and now it's came down to and the results are excellent. So to think, when the consumer gets back into control, that thought process, I think, changes. That would probably be the same thing with plastic surgery when people are doing elective surgeries. And you go in that door, like when Shawn had his eye surgery done, there was no guesswork. They knew how much time was going to be involved. He got to sit there and talk to them back and forth. And the point you made about giving better service, I think, is so true, because he knew exactly what to expect and what the results should be when he was walking out the door and leaving. And so that connection between the surgeon and the staff was probably better because of that interaction versus, like you said, the customer is the insurance company. Because if they're paying, you're just kind of
a vehicle, like David said.
Yeah.
One thing I want to comment about that too, about the BUCAs, is I also want to say this, is that government insurance, Medicare and Medicaid, are the same as the BUCAs. And when you look at some of those BUCAs, because of some of the rules that have come into play over the last few years, and because we don't bill insurance, I don't keep up with it very much, but a lot of those BUCAs have piggybacked onto Medicare. So these Medicare Advantage plans or whatever that are actually under, they're under United Healthcare or whatever they are. So here's what I say about it all, Daniel, and you kind of took it back to Medicare, kind of screwed everything up. I think
David, but you're not the only one.
Even though we have that name in front of us on the screen.
Yeah, right.
I respond to both.
Anyway, and the traditional health insurance, the BUCAs, they are so heavily regulated by the federal government under Obamacare that they're really, if you have the BUCA plans, Blue Cross, United, whatever, it's government insurance, because they're told what to pay for at what price. So I just wanted to clear that up. That it's
absolutely, completely agree, and heavily subsidized. My brother-in-law was just shopping for insurance recently. He just got married, was looking at insurance, and I was telling him you need to get a insurance alternative to healthcare. And before sitting there, I was about to go into how ridiculous insurance is. So I went ahead and just went to the ACA website, the Idaho Health Exchange, and just wanted to kind of every once in a while, you live in this world day in and day out, and it's always good to go right to the primary source and just make sure that you're still in touch with the data. And so I pulled up plans. I put in a fictitious income and I went through the thing. I was blown away at how horrible the plans were. And then you could also see how much the government was subsidizing. So you see, even with these, based on your income, you see how much the government's paying. The government is paying most of the plan. So it's like, to say that that's not socialized medicine, that's not government insurance is a joke.
And let's just call it what it is. The government subsidizing it means they're stealing from the taxpayers. They're stealing money and giving to somebody else. That's really what it means.
And creating a whole host of perverse incentives along the way.
Absolutely. So let's go ahead and stream that Facebook post, Julie, and we'll talk about a case that my brother had recently at your guys' surgery center. And it was just a great experience. And we're getting lots of engagement from this Facebook. So first of all, let's go ahead and just go through the pictures. So here's his son, Finney, after surgery. I don't know how long post-surgery was, but I just want to say he got great surgery, transparent pricing. Go ahead and go to the next picture. So here's the check that he wrote to Veritas. I think Veritas quoted like $9,000, and Christian Healthcare paid $5,000, or it paid like $4,000 because Shane was responsible for $5,000. So no surprises, no surprise bills later. Go ahead and the next picture. This is his explanation of benefits, even though it's not insurance. He was responsible for the first $5,000. Next one. And here's what I thought was really cool. Not that one. Let's go to the next one. Here's what I thought was really cool, David, here is a personal thank you from the CEO of Veritas Surgery. If anybody has ever gotten a personal thank you from the CEO of a hospital, and I don't mean some candid thing that's already written, I mean something personally written like this, I would love for you to tell me about it, because I've never heard about it. So another thing, so let's go get out of the pictures, Julie, and a little bit about this post. My brother talks in this post about how in 2010, when Obamacare passed, he started doing Christian Ministries, Christian Healthcare, CHMministries.com, correct? And just listen up, people. I won't re-say this because it is true, and I want you to look at it yourself, and we can show you the numbers. Based on traditional health insurance, which costs about $1,800 a month for a full family, he has saved in 14 years, get this, $200,000 on insurance premiums. Why? Because now he pays $184 a month. And this is what he gets from it. He gets to decide what surgery center his son gets surgery at, the quality, the price. And when he talked to the hospital, the local hospital, Gritman Regional Hospital, and I would love, if anybody from Gritman is listening or watching, I would love for you guys to reach out and explain your pricing module. The price was going to be at least $27,000, but that included the surgery, only included the surgery. It didn't include all the other add-ons, the physician fee and the anesthesia and all that. So it would have been upwards of $40,000 for the same surgery. We've already qualified that the quality is better at your place, or at least as good. Let's say that. And
so
you can go and remove
I can interject. Yeah. So that's our partner, our facility partner here with Palouse Surgery Center, which is an ambulatory surgery center, which statistically ASCs, I mean, we need hospitals. They're important if you're in critical condition, but it's insane to send a healthy person to a hospital for a planned surgery, because statistically the rate of secondary infection, I'm not talking about specifics here, I'm talking across the country. The rate of secondary infection at a hospital is double the rate of secondary infection at an ASC, because an ASC is specialized, an ambulatory surgery center is specialized for that application, and they do their thing really well, and it's a lot cheaper. And so, yeah, that's one of the biggest quality metrics right there.
Absolutely.
Why it's crazy to send healthy people to a hospital for a planned surgery.
And let's face it. I mean, for a scheduled surgery, an elective surgery, surgery centers, that's what you do all the time. That's what you do, so that you're going to be better at it.
Economies of scale. Yeah.
Yeah. And for two, sick people are at hospitals. That's why another reason you have all these super bugs, because they're at sick people are at hospitals.
Right.
You know, if you can do an elective surgery, go to an outpatient surgery center. So, so on this, what I'd like you to comment about is, I would like you to comment about, tell us how even because of some of the pricing issues, even if somebody had traditional insurance, your surgery center, your surgery at Veritas might be cheaper. Give an example, might be less expensive to pay cash than it would to use traditional insurance. Go ahead.
Yeah. The reason is traditional insurance, and I'm assuming here that we're talking a fully insured product, not a self-funded insurance product. That's its own conversation. But a traditional insurance model where you pay premiums, and so you get financially scalped every month by these exorbitant premiums. You still have a co-insurance, and you still have a deductible, and then you'll have a maximum out of pocket, one for in-network, another one for out-of-network, one for you individually, one for your family. You have a you end up in a situation where, because patients are not shopping, because patients are not acting as customers, they're just going where they're told they're allowed to go. And because the decision makers in that equation want high bills, both payer and seller, buyer and seller, you end up with a situation where, in addition to the insane premiums that you're paying every single month, your patient portion, your 20% of an exorbitant provider bill can often be more expensive than 100% of a reasonably priced bill at a direct care provider. So yeah,
go ahead.
Yeah, I mean, you run the math on a 20 or 30% coinsurance on a
$50,000 surgery.
80, right. I was going to go like total joint replacement. You could easily have $60,000, $70,000, $80,000 billed charges. Your portion of that could be more than 100% of, and so typically for a major surgery, you're going to hit your maximum out of pocket. And so that's the number that matters. So it's like, let's say you have a $10,000 maximum out of pocket, then there's a lot of situations where your total bill at a direct care provider, like Surgery Center of Oklahoma or Veritas or Wellbridge Surgical, your total bill is going to be under less than your maximum out of pocket. Because again, it's cheaper to pay 100% of a reasonable price than 20 or 30% of a just outrageously pulled out of thin air price.
Right. And using my brother's son's surgery as an example, he paid $9,000 all inclusive, transparent, no surprises. Gritman quoted him at least $27,000 for the surgery. We know that anesthesia, doctor's fees, and lab fees and all that kind of stuff are going to add up to $10,000, $12,000, $13,000 at least. So all we got to do is get to $45,000, which 20% of that is $9,000, and you'd be better off paying cash. I don't think people realize that, though.
No, we don't.
Go ahead.
No, we don't, just because we've been brainwashed with this idea that, the responsible thing is to have insurance. Everyone needs insurance. And every time you get traditional commercial insurance, you are perpetuating this cycle of price inflation. And that's probably where, we've mentioned several times that the insurance carriers wanting high bills. I think that's probably, you kind of have to unpack that. People will go, that doesn't make sense. They're paying the bills. Shouldn't they want low bills since they're collecting the difference between the premiums and what they're paying out? And that's not the case for several reasons. One, this really got a lot worse at after the passage of the so-called Affordable Care Act, where one of the provisions of the ACA was something called the medical loss ratio. And the medical loss ratio says that insurance carriers have to spend 80 to 80, depending on their size, 80 to 85% of the dollars they bring in premiums has to go to medical care, has to go to providers.
So they just raise the price.
So you imagine what happens when, so what that means is their profits are capped to a percentage, they're only allowed to turn a profit on 15% of what they bring in premiums. That means the only way that company can grow their profits is to convince the providers to raise their bills.
Right.
Wow.
They have to make the pie bigger so that their piece of the pie can grow. There is no incentive for cost containment because it's legally baked in.
Right.
So when they then go to a hospital and say, hey, hospital, hospital A here, well, okay, so the other way they make a ton of money is by selling access to those fake discounts to self-funded employers. And so they need these huge discounts. So they'll go to the hospital and say, hey, we demand 70% discounts off billed charges or you're going to be out of network. Well, the hospital says that wouldn't work for us. So, what we're going to have to do is we're going to have to double our prices. And then the insurance carrier says, okay.
Crazy, right? Yep. And then they're like, oh, yeah, good job. I know you gave a discount. Thanks for the 70% discount. I don't think people realize it. And here's, I'm just going to say it, David. And I get it that some people don't like hearing this, but that story alone is basically where hospitals and clinics are colluding with insurance companies to rip off consumers, period.
Well, they're often owned by the same entities. You look at you pull up an SEC filing of United Healthcare. Look at all the subsidiaries. They have their hands in both pockets. And so that's where they're meeting the medical loss ratio by spending other people's money and then collecting with the other hand. I mean, we're talking PBMs, pharmacy benefit managers,
Yep.
medical device manufacturers, everything along the supply chain, they have their hand in the cookie jar. And so then everyone throws their hands up in the air and says, healthcare costs are just going up again. Sorry, premiums are going up 8%, 9% again. Just nothing we can do about it. So sad.
Yeah.
And their business model is now predicated on those prices continuing to go up, because not only do they make more on the medical loss ratio, they get to sell more fictitious discounts. They get to collect on the spread when they sell it to the self-funded employers, and they get all of the backstream revenue from the medical, where all these bills are getting paid. All the suppliers at the pharmaceutical level, at the medical device level, that's funneling back into the carriers' pockets. And because of the way the medical loss ratio applies to consolidated financial statements, the money they make from those backstream revenues does not apply to the medical loss ratio, does not apply to those dollars. And so you have, it is collusion. It's one of those situations where you feel like you're using a word provocatively and maybe overstated until you look it up on Webster's and you realize that what I say is I think Keith is the first one who called it this, but it's a cartel.
Yeah,
The dictionary definition of a cartel. You have entities colluding to maintain high prices. And this is the part that cracks me up. You even have the hitman with the baseball bat going to make sure you buy the product. It's called the IRS.
That's right.
You will buy the product. We have this horrible product. And if you don't buy it, we're going to tax you.
Right.
It's a cartel.
It is. Well, and cartels also do some pretty nasty things to stop other people from getting into their business. And when you look at this, we could go on and on, but when you look at what certain hospitals have done in certain states with certificate of need laws, they've made it almost impossible for doctors to open their own surgery center. Or for instance, because of Obamacare, it's illegal for a doctor to own a hospital.
Yeah.
I don't know if you knew that, David.
Oh, yeah.
It's illegal for a doctor to own a hospital. I mean, think about that.
And think of the reasoning. The funniest part is, that would be such a conflict of interest. We can't have physicians benefiting from the care they're giving. Let's let the insurance companies own the hospitals. That would be such a
I know. It's crazy. Well, yeah. And it's like, I mean, pharmacists own pharmacies, right? Mm-hmm. And attorneys own law firms. I mean, it's crazy. It is crazy. And it's just, fortunately, there's a parallel system, the free market system, which you are part of. And thank you so much. So let's talk about the alternative to traditional health insurance. And let's go ahead and stream that Samaritan Ministries website. So Daniel, you are on the board of Samaritan Ministries, correct?
I am. And
tell us a little bit about health sharing and how it works in general.
So healthcare sharing ministries are, and one note, I'm on the board of Samaritan. I have a certain bias there, but there are multiple fantastic ones. And this is really one of those situations where a rising tide, lifts all boats. And so, I can talk more specifically, speak to Samaritan, but there are some multiple really great ones. And it's just a model that overall I want to encourage. So healthcare sharing ministries, it's risk pooling without the misaligned incentives of insurance companies. So it is not insurance. And that's a very important part legally. A lot of people are like, oh, that's not real insurance. Yeah, no kidding. I know it's not insurance.
Exactly, right? No kidding.
It is a community. Most of them are faith-based. Like Samaritan Ministries is a faith-based organization, and that's where they started. It started back, started with Mennonites. Well, it's been going for thousands of years. Depends how far back you want to go, but it's very often faith-based communities who are simply sharing each other's medical bills, because from an actuarial standpoint, self-funding is the most efficient way to pay for medical care. There is no amount of centralized planning that can compete with individuals acting in their own self-interest. So the the self-funded employer space has figured this out. You have companies that go self-funding now, and we're actually spending not somebody else's money, we're spending our money. There is, as soon as you have someone spending some variation of their own money, whether it's me personally or me, this group of people, me, this larger, us, the members of this larger sharing ministry, anytime people are spending our money or my money, that is going to be a completely different calculus than I'm spending United Healthcare's money and I'm really ticked off at them. But now that I have an episode of care, it's not my problem anymore. That's somebody else's problem. So when, in contrast to that, when you're spending pooled resources, you act as a consumer. You shop around, and healthcare sharing ministries are increasingly working with patients to act as informed and incentivized consumers, where they're, like, we don't have networks, but when you do go to the trouble of finding a fair price provider, there's incentives and rewards built in. So for example, at Veritas Surgery here, we have, if you remember, just to list the two that we have partnerships with right now, Christian Healthcare Ministries and Samaritan Ministries, both of those, if you get surgery at Veritas, they will completely waive the member responsibility, essentially the deductible, the initial portion you would normally pay, the what we call the deductible or the co-insurance in the insured world. There's equivalences to that in the cost sharing ministries, and they will completely waive that, and actually also pay your travel expenses. So we had a rotator cuff repair from Standpoint a few weeks ago. And this was one that Dr. Hazelwood did. The patient was part of a healthcare sharing ministry. They were scheduled at a large hospital system up there. And in that case, I believe they were quoted about $40,000 for the rotator cuff. Their cost share ministry said, hey, here's your member responsibility. Yeah, we're going to cover it. It's going to be shared among the members. But, hey, did you know there's a direct care provider a few hours south in Moscow? If you want to go with that, it's completely voluntary. If you want to go with that direct care provider in Moscow, we'll completely waive your out of pocket. We're going to cover your travel and lodging expenses. Plus they get a meal catered through Veritas. We now provide meals. And you're ending up with providers who are, skilled surgeons who are delivering first-rate surgery in the free market, saving the health share tens of thousands of dollars.
Exactly.
And then the health share rewarding them financially for saving that money on behalf of the other members. So that is such a beautiful picture of market efficiency and aligned incentives there. And so that, I think, that's the future of healthcare. When you have people who care about the money they're spending, who actually want to be good stewards of those resources, you have the ability to reward and bring your business to people who are going to meet you there, who are going to provide high quality care at fair prices.
Yeah, and that's one of the reasons that the health sharing ministry did that, because they knew, I don't know what the consumer's out of pocket was going to be, $1,000, $5,000, but they knew that it was going to save them more money to go to Sandpoint, pay for their travel, waive the copay, than it was going to be then have it locally at a hospital. And I will tell you, in May of 2020, we had Christian CHM Ministries, and my son, 18-year-old, jump in a canal, irrigation canal, compound fractures left tibia. And it was, I was trying everything I could do to talk my wife into seeing what we could do to get him to Surgery Center of Oklahoma. My wife wasn't going for it. I will tell you, David, just on principle, seriously, if it was me, I would have found a way. Well, now I would just go to Veritas. I'd find a way. There's no way I would do it locally. Now, if it was my own kid, maybe different, but just because I just don't want.
Yeah, here's an interesting comment on the locally aspect. A lot of these people are in this broken system. Some of those local partners we're working with are part of this broken system who want to see it differently. So it's not even a question of like doing it locally. Ultimately, I believe in localism. I want to see. So I think it's I want to see this model replicated all over the country the way we've seen with direct primary care. Yeah, I think it's a testament to how messed up it is that people can travel, that it can make so much sense to travel across the country to Oklahoma or Indiana or Dallas or Idaho here. But this model, I want to see it so proliferated that every town has a direct care option. And a situation like the, your nephew's ACL repair, that was through providers who are part of the system, that they can't just on a dime suddenly stop taking insurance and break out of this broken system, but they can get one foot in that world. And so yes, you often end up with the exact same providers, the same surgeon, the same facility, the same anesthesia group. It's just being run through a completely different financial ecosystem, one that aligns incentives and that doesn't keep, as Matt Ort would say, feeding the beast.
Well, and that being said, just as we're on that topic, I talked to a doctor about this same thing again when we were comparing quality to, hospital-based surgery versus a cash-based surgery center like yourself. And she made an argument. I didn't even get it until she said it, but she says, well, actually, you could argue that cost is so important that quality is more important at a cash-based surgery center. For instance, if Veritas had a bad surgeon that was opening up the wrong sterile supplies and it cost $2,000 and it costs the surgeon it costs the surgery too much money, or he had a bad infection rate or something, you guys would not let him come back. Seriously, right? You agree with that?
Yeah, absolutely.
Whereas the hospital sometimes
we
protects
are on the line for the reputation of everyone we partner with. And so, yeah, you end up with a trust-based relationship, but that is just rigorously pursuing quality, because you know that if that your reputation is on the line.
Yeah, absolutely. So I wanted to mention, and this might put you on the spot, but I don't think so. So when it comes to health shares, we're talking about the faith-based ones. Are there any non-faith-based health shares for people that don't want to use go ahead.
Two that come to mind are Sedera and Zion Health Share, and I believe there are a couple more. So it's a model that is predominantly been faith-based, and I would argue that the best ones are, but there are alternatives that are not that are secular. And by and large, I say any model that operates like that is going to be light years ahead of any traditional insurance alternative, because you're dealing with you're correcting the fundamentally misaligned incentives. So did you want to continue unpacking a little bit how health shares work? Just kind of
and let me give an example of mine just to let people know on health shares. So I'll tell you just how good they are is and speaking of the waive and the copay. So when my son broke his tibia, he, you have no idea what the price is going to be. Literally, after I hung up with my wife, because I was out of town, I'm like, what's it going to be? 10,000, 20,000, 30,000, 50,000? You don't know. And so it's just going through your head. Oh, well, the health share is going to pay for it. Well, yeah, but still I care. I want to be fiduciarily responsible. Yeah. So anyway, after all the bills said and done, came out, it was $48,000. At the Surgery Center of Oklahoma, I talked with Dr. Smith. It would have been about $8,000. No surprise, right? Usually it's about 8 to 1 is the difference. And then I negotiated a discount, which, by the way, just to let you know, in Washington State, the hospital groups have such a big lobby. They have put a law into place where if you have a health share in Washington State, they cannot give you a discount legally. So here's what you say. I'm teaching you this, David, for your patients that come to Idaho, because you're going to be getting some. You've already got one from Montana that I sent you last week. They just did surgery last week.
Thank you.
You're welcome. And in Washington State, you can't negotiate a discount because they found all these health shares were negotiating these discounts to get the price down to what it really should be, right? Mm-hmm. So make sure, David, you tell your patients, we're cash pay.
Cash pay.
Cash pay. How I get reimbursed is none of your business. Exactly. We are cash pay. Don't even tell them you have a health share. I know that's crazy to say.
That's the MO. That's normally how you operate. You say, I'm self-pay, And that's often how they're all structured a little bit differently. But like with Samaritan, there's not even any centralized pooling of money. You're literally sending checks or PayPal payments to other members. So it is 100% decentralized. It is a group, a body of members paying each other's medical bills, very well organized, and you get all the paperwork, all very carefully tracked, but it is not insurance. And so it's so important that the patients say, no, I am not, I am self-pay. And then you negotiate a self-pay discount.
And thanks for the explanation. Members are actually paying other people's bills, and it works. We had Samaritan Ministries with my youngest son. My oldest son broke his wrist back in 2014. It worked wonderfully. With my oldest son, with my youngest son, when he broke his leg, we had CHM Ministries. And one of the reasons why is because Samaritan at the time didn't have tiered memberships. And we were able to go with CHM because they had a tiered membership without OB coverage. We didn't need OB coverage.
Right.
So we saved quite a bit. I think Samaritan's changed that since. Is that true?
They now have Samaritan Basic, which is very similar to the program you're describing at CHM.
The bronze plan, probably. Good. I love it. That's how free markets work, right?
Exactly. You respond to market demand, price signals. Absolutely.
Right. So anyway, after I negotiated a discount, even though the discount was illegal and the hospital said they were doing me a big favor, they gave me a 20% discount. Within a week. Yeah, I know, right? I feel so special. Thank you. Within a week, they had to cut me a check for $37,000 after that. I had a check in my hand for $37,000. They work. Heart attacks, cancer, they work. Right?
They do. And I would say also, do your own research. There was an era when there were a couple bad players, and so I think those in that space, whether it was actual bad players or just incompetence, there were some bad stories a decade or so ago. And so do your research, join a reputable healthcare ministry. But what else is new?
Yeah, right. I mean,
do your research, join a good one. Yeah.
Yeah. You're telling consumers to price shop, just like they should on healthcare. Same thing with your insurance or your health share.
Yeah.
Right. And you shouldn't let a few bad health shares give bad names for all of them. And CHM Ministries and Samaritan have been around for decades and decades with a great track record.
And there's others.
Absolutely. Yeah. So we got some comments. Julie, are they? Let's start. What's that one? Oh, your brother's watching, David.
That's Daniel.
All right, what's the next one?
I think we both respond to both Daniel and David.
Let's see. Paul Herman says, "Oh, this is an incredible podcast. Thank you, Paul. I saw that you were on my brother's post earlier. I really appreciate you watching and commenting. What's the next one?" Wow, that's nuts about Washington State. Yeah. Why do you think my wife and I leave here a lot? It is crazy. It also tells you not only where Washington State lands, but also tells you how strong the lobby groups are, the hospital lobby groups. I guarantee you, if you follow the money, the hospital lobbied to make it illegal for hospitals to give discounts to people with health shares. So anybody that has a health share, if you go to a hospital, just like David said, you are self-pay. And how you get repaid is none of their business. I got to follow up. I got to give a little bit of a tail on that story. So I negotiated the price with the hospital, and I said, what's the longest I can take to pay this payment, which was $37,000. What's the longest I can take to pay this and not to pay any interest? They said, oh, that's great. They said, we can do 12 months, no interest. So it's like $3,500 a month, whatever. After I received the check, talk about mob tactics, David. The hospital contacted me after they threatened to send my son to collection a couple times. They contacted me and they said, well, this is not fair. You got paid the entire amount and you negotiated a payment plan with us over 12 months. I said, so they wanted to renege on their deal. I'm not kidding. I am not kidding. And I said, wait a minute. Didn't you agree to this? And aren't I paying? Have I missed any payments? Well, no, but it's not fair. That's the kind of stuff we deal with when we have non-transparent pricing. They get to hide behind all this crazy stuff like that. In any other business, David, you would never, ever, I would never say that to one of my customers and say, well, I said that, but I don't really mean that. I want it paid now. Right?
Yeah. And that is part of the frustration with even the way a lot of the cost containment works when you have something like a health share who's trying to advocate on your behalf after the fact is you end up with these conversations that shouldn't be happening in the first place if everyone had agreed to the pricing ahead of time.
Yeah.
Like you don't,
Exactly.
it's just, you're just off on the wrong foot if you're trying to discuss the terms after the service has been rendered. And so, sometimes like, for something like elective surgery, that's easy, but you could have, this could apply just as much to emergency care by simply saying ahead of time, this is the price, this is how we bill, this is, you post your menu.
Yeah.
You say this is,
right. And in general, David, you know this as well as I do, in all of healthcare, Dr. Keith Smith quotes this often, over 90%, I don't remember the number, but it's a high percentage of all healthcare is shoppable. It's not a true emergency. I mean, think about the things that aren't really true emergencies. And even if they are true emergencies, it's not that they haven't been done before. So there's not that many things that are truly novel in healthcare. We might like to believe that it is, but it's not. So
the insurance companies have negotiated rates for all these unpredictable scenarios. There's no reason you couldn't make those shoppable and transparent.
Exactly. Oh, David, we could talk for hours. I'm looking so much forward to seeing you here in a month or so. So as we wind this podcast up, David, I got to ask you, what do you have a passion for?
Healthcare?
Everything, anything. What's your biggest passion? I mean, be honest and truthful.
Healthcare reform, my family, the local church, the free market reform. Just the I believe we live in a world, God placed us in a fruitful world. You work and it bears fruit. So we see brokenness all around us. We see the result of the curse. We see just the result of sin, the result of the sin and death and brokenness that pervades every aspect of life. But we also see the beauty of redemption and of the grace that we have, the fact that we can work with our hands and fix broken things. I think that is incredible. And we're blessed to live in a country where we, despite seeing very troubling trends of starting to lose a lot of those freedoms, we still, by and large, have the freedom to apply ourselves to the opportunities we see and reap the fruit of that work. And so just that free markets, the beauty of free markets.
I love it. That really sums it up, Daniel, and I agree 100% on everything you just said. So if anybody has any questions or wants to get a hold of you, what's the best place for them to get a hold of you?
Shoot me, connect with me on LinkedIn, or just email info@veritassurgery.com. That'll get through to me.
Awesome. Well, I so appreciate you being on. Our goal, David, of this podcast is to educate and empower consumers to take charge of their own health. And part of that is financial. I think consumers should be financially responsible for their own bills, and we can fix this mess if we do that. So thank you for helping us realize that goal, David.
Well, thank you, Shawn. And
You're
hey,
welcome.
I look forward to seeing you at the conference next month in Spokane, and then also at the Free Market Medical Association conference in Oklahoma City.
That's right. Yeah, that's going to be, I'll see you there before I'll see you in Spokane. That's right.
Oh, wait. I didn't even realize the dates.
Yeah, because like the 10th or something, 10th through 12th of April. So yeah, that'll be great. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Thursday to our midweek podcast, 3 to 4 p.m. It's a different scheduled time for our guests in the afternoon. You don't want to miss. We're going to be talking about marriage, healthy sex, and healthy hormones. You don't want to miss out. Thursday, 3 p.m. to 4 p.m. Pacific Standard Time. Health Solutions with Shawn and Janet Needham. Thank you for tuning in.